So, hi Tracy, do you want
Hi.
to tell us about what you do?
I'm an occupational therapist working in the Falls Therapy Service.
How about you, Stacey?
I'm also an occupational therapist, but I work in the Telford Intermediate Care Service in Telford. And what do you do?
I'm a physiotherapist and I'm also an intermediate care services but based in the southeast of Shropshire.
Yeah.
So how long have you been in your post, Stacey?
So I've been in post, I joined just before COVID, before the pandemic hit. So about 3.5 years I've been in post. I personally prefer it to the acute setting. So
Yeah.
it
same.
has a better work-life balance for me personally. So yeah, and how about you? Did you?
Yeah, I started my career in the acute unit, which was very much a traditional route for physios after qualifying. So I was quite sort of standard in that respect. And then my career's taken several different pathways in terms of living overseas and also going into a few different roles involving healthcare management and commissioning as well, just to add in a bit of variety. And then having gone abroad and come back, but my background is very much community-based, and like you, that's what I enjoy. I like the variety of the work in particular, in that you can go from a respiratory patient to a back pain to a stroke patient, and that mix of a caseload is what I really, really enjoy.
I started in hospitals as well. I did a rotational post from
Yeah,
university.
same.
Same.
So you get sort of 4 months or 6 months
Yeah.
in lots of different departments. And then found I was doing more with older people, so community was the logical step.
Yeah, exactly the same.
I prefer community as well.
Yeah.
So now that I'm in the community, I very much appreciate all that I learned in the acute setting, because I really find that I'm quite often falling back on the knowledge that I learned when I worked. You don't realise it at the time, but
I think it gives you that sound clinical basis, doesn't it?
It does, yeah.
And then 5 rehab techs.
Yeah.
So we all do, a very similar job day to day, but rely on each other's sort of expertise when there's particular issues.
And now there seems to be much more of a team of rehab techs that work with us, which really support us in our roles. It was when I did a student placement in the community as well that it opened my eyes up to working in the community.
And that was one of my first jobs, was going around the county looking at what everybody was doing, looking at what the guidelines were saying we should be doing, and then trying to draw it all together so that wherever you were in the county, you were getting a similar service.
So you've been very much part of the service all the way through then, Tracy.
Yeah.
That's
Highs
good.
and lows, yes.
Yeah.
Then we do very much support each other. So if I have a patient that particularly has a shoulder injury or a frozen shoulder and I don't know how to assess it, and it's really not, I'm not qualified to do that, then the support is there, and so we support each other.
Having worked in a generic team and with other professionals, you realise that you can you've always got that professional identity inside you, and you bring that to whatever you do. So 2 years ago we were working very differently. 5 years ago it was very different again. So it is continually evolving. So I enjoy it. I do enjoy going to work.
So I would say I'm a little bit unique in our team, that I do very much use my physio skills on a day-to-day basis. Yeah, I like the reference you just made to the fact that your day often changes. And I think that's one of the key skills we have.
I'm supposed to be on triage, on duty all day.
I think that's something we learn to deal with in the community a lot more, because no matter how well you plan your day, things inevitably change, and any urgent referrals that come through that do need, and I think that's a skill set you learn to develop.
Yeah.